Is it true that there are vitamins you can take to get pregnant faster? This is one of the questions we are going to answer in this video, where we are giving the 12 tips of getting pregnant faster.
Ask Dr. Uthuman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Uthuman YouTube channel, a channel where you learn medicine at the comfort of your living room. I told you if you'd like to get in touch with me to have a private chat, go to my website www.druthman.com, book an appointment. I'll be there, we shall chat and you get a solution to your problem. And if you'd like to get in touch with us also, you can go to all our social media platforms. The name is Ask Dr. Uthuman. If your question is not so private, you can ask a question on all my timelines. I'll be there to answer when I get time. But if your question is private, you don't want other people to know about the issue, then you can book an appointment on my website www.druthman.com and we solve your issue. Now, today we have a very important topic we are discussing. Actually, there are several questions that have been flocking my inbox asking about the same issue. And I decided to pick a few people. And number one is Jocelyn Faraha. She says, "Hello doc, what vitamin supplements can I use to get pregnant faster? My family is at the verge of breaking because of no child." This is a very serious issue. And someone else is saying, "I am Cheska from USA. Thank you so much, Doc, for the work you do. We really appreciate. Doc, is it true that there are vitamins you can take to get pregnant faster?" So the main issue we are talking about here are the vitamin supplements. Is it true that there are vitamins that someone can take and get pregnant faster? My answer will be yes and no. First of all, you should understand that most times the reason as to why someone is not getting pregnant, there are diseases or there are pathologies associated with this. There are several pathologies associated with infertility. And I remember in one of my previous videos about infertility, we discussed the several causes of infertility. Now, vitamins, it's true that there are vitamins that can boost fertility. However, the only problem is that people will take these vitamins even when there is an obvious pathology. For example, if your tubes are bilaterally blocked, you don't need to take these vitamins. If you know that the problem with you is the hormonal imbalance, you did a fertility hormonal assay and found that progesterone levels are low, estrogen levels are low, you don't have follicle-stimulating hormone, then there is no need of taking these vitamins. So what am I saying? Vitamins, it's true that vitamins can boost fertility, and I'm going to list them. I'm going to give you the 12 vitamins that can help you to boost the fertility. However, do not use them if you know that there is a clearly known pathology. You have spent years without conceiving. First, go to the hospital, do fertility tests. Do an X-ray, do an HSG X-ray, do an ultrasound scan, do blood tests. First, find out the cause. Unless the cause is not clear, everything sounds to be okay, then you can decide to boost on the fertility. And also, most of these vitamins act on ovulatory infertility, whereby someone has a problem with ovulation. Menstruation is okay, everything is okay, but the problem is with ovulation. It may be at times they miss their ovulation, 2 months they are not ovulating. Such people are the right candidates for using vitamins to boost their fertility. I hope this is very clear to everyone. Now, number one vitamin is called Acetyl L-carnitine. Acetyl L-carnitine. This is an endogenous vitamin. Actually, it's an amino acid that facilitates gluconeogenesis. This is too much science, my colleagues, but this is an amino acid. By an amino acid, I mean it's a vitamin within the body that helps to convert lipids or fats into glucose. What do I mean? Usually, when you eat starch, Starch, you remember the digestion, in our elementary school, in high school, we studied about digestion. Now, when you take fat, when you take starch, food containing starch like cassava, like potatoes, when you eat them, they are converted, they are digested in the body. And now during digestion, there is conversion of starch into glucose. So the food you've eaten will finally be converted into glucose, which is the simplest form for assimilation or for absorption. Now that is a process called glucogenesis, like a process whereby the body gets glucose, like a process whereby food is converted into glucose and taken into blood for the body use. Please come back. I am saying that when you eat food containing starch, it will be converted into glucose, which is the form that can be absorbed by the body. And the body needs glucose, especially the brain. However, during periods of starvation, for example, you've taken long without eating, like for example, people who are fasting, the body may look for starch. There is no starch in the body and glucose is getting depleted. What the body is going to do is to visit the lipids, the fats. It is going to visit the lipids, the fats, and some other, like even the proteins. What it is going to do is to convert these fats, all the lipids, into glucose. And this process is what we call gluconeogenesis. I am sorry for bringing such big words, but I have to explain to you clearly to understand this. So this process of gluconeogenesis is assisted by a vitamin called acetyl L-carnitine. Now, it is an endogenous hormone. It's an endogenous vitamin. It's always found in the body. But this vitamin is an antioxidant. That is where now, that is how it is now going to help us in reproduction. It's going to help us in fertility. It's an antioxidant. And because it's an antioxidant, it will promote the general good health of the reproductive system. It is an antioxidant, and most antioxidants are known to promote the health of our reproductive health system, the female reproductive health system. And therefore, that's why you can take this this vitamin acetyl L-carnitine to boost your fertility. And the doses you can use around 1,000 to 300 milligrams daily. So if you're planning to conceive, you really want to conceive, I've talked about first ruling out the other pathologies. You don't have any of the other pathologies, you can start taking this vitamin acetyl L-carnitine in 3,000 to 1,000 to 3,000 milligrams daily, and I am telling you, your fertility can be boosted. Another vitamin we are talking about here is vitamin B6 and vitamin B12. These are wonder vitamins. They are wonder vitamins. I will tell you why. They promote good egg quality. Vitamin B6 and vitamin B12, they are known for promotion of good egg quality. And they also prevent ovulatory infertilities. You know, like I've said in my introduction, is that most of these vitamins are going to help us in ovulatory infertility, whereby someone is having ovulation irregularly. Like today this month you have ovulation, after 3 months you're having menstruation, but there is no ovulation. Actually, why is vitamin B6 and vitamin B12 important in this? This is known that low levels of homocysteine impact or improve chances of conception. The body needs low levels of homocysteine. Homocysteine is another substance in the body. And when that substance is very low, the chances of you conceiving become high. When the levels of homocysteine, which is a substance, it's also an endogenous substance in the body, when they are low, the chances of you conceiving become high. Actually, there is a study which was done by the Medical Journal of Reproductive Toxicology, and it found out that vitamin B6 and vitamin B12 lower the levels of homocysteine. Now, this is where the role, this is how we apply the vitamin B12 and vitamin B6 in this issue. Because what I've said is that we have a fact, there is a fact which is known that low levels of homocysteine increase or improve the chances of conception. A study was done by the Medical Journal of Toxicology, of Reproductive Toxicology, and it found that vitamin B12 and vitamin B6 can lower the levels of homocysteine. Therefore, if you take daily vitamin B12 and vitamin B6, you will decrease the levels of homocysteine. And therefore, when you decrease the levels of homocysteine, you are going to increase your chances of becoming pregnant. Now, this medicine or these vitamins, vitamin B12 and B6, can be taken in the following doses. You can take 1,000 micrograms per week, that is for vitamin B12, and 1.2 milligrams of vitamin B6. When you take that, you'll be able to boost your fertility. Now, there is another very important vitamin, and this is the tip number 3, that is vitamin C. When I talk about vitamin C, someone will feel like, yeah, but I usually take vitamin C. These are, yes. Vitamin C, remember, is also an antioxidant. It is an antioxidant. Now, the vitamin C reduces the negative impact of free radicals. It reduces the negative impact of free radicals, and in turn reducing the cellular damage in the body. Because you reduce the negative impact, you reduce the free radicals in the cells, you now reduce the impact, you reduce the damage to the body cells, to the tissues, all the body cells. Now, when you do that, when you reduce that, you'll be able to regulate the menstrual cycle. You'll be able to regulate the menstrual cycle and also promote normal ovulation. So this is how vitamin C is going to help us in boosting the fertility. One, it is going to regulate the menstruation and also promote normal ovulation. I told you, you cannot rely on this vitamin C to regularize your menstruation and ovulation when there is a known cause. For example, you have low levels of progesterone, in other words, if you have hormonal imbalance. Like I've said in my introduction, this is just a supplement when the other ones are still fine, but you want to really boost the fertility, the body, and so on to conceive. So the daily dose you can take 75 milligrams of vitamin C, and you can also take this vitamin C from the fruits. There are several fruits which contain vitamin C, like oranges and so on. Now, the fourth vitamin, which is very important, there is a serious vitamin called Coenzyme Q10. Today, I think I'm really bringing very difficult words for you, my colleagues, but there is an enzyme called, a coenzyme called Coenzyme Q10. This is also an endogenous substance. When I say endogenous, I mean a substance which is secreted by the body, like which is found. The body already has this substance. That's why you call it endogenous. It's already, the body already secretes it or it produces it. So coenzyme Q10 is an endogenous substance, and it also has an antioxidant effect. Actually, you'll find that most of the vitamins we are talking about that boost the fertility contain antioxidants. Now, because of that, there is research has shown that coenzyme Q10 improves the egg quality. The quality of your ovum is improved by coenzyme Q10. It is also known that coenzyme Q10 helps in thickening of the endometrium. It helps in thickening of the underlining of the uterus. And research has shown that women with a thin endometrium, with a thin lining of the endometrium, have higher chances of infertility. Like they take long to get pregnant. And those with a little bit thickened endometrium have higher chances of conceiving. Now, this is where coenzyme Q10 plays its role in thickening the endometrium. So, If you've really taken long without conceiving and the other factors are okay, then you can swallow tablets or medicines containing coenzyme Q10. This will promote fertility. And the dose you can take 100 to 600 milligrams daily, but you should always stop coenzyme Q10. You should always stop it when you conceive. The moment you conceive, you stop taking that. So there are also some other food substances. There is food you can take to increase coenzyme Q10. For example, organ meat, the organ meat. What I mean by organ meat, I mean eating the liver, taking the liver, the kidney, the heart, that is the organ meat. Those ones have high levels of coenzyme Q10. Foods like spinach, actually spinach also increases the levels of coenzyme Q10. Another vitamin, that is vitamin number 5 we can talk about, is vitamin D. Vitamin D is gotten from sunshine. From sunshine, especially the sunshine at around 10 a.m. 10 a.m., 11 a.m. In my language, we call it kalasamayanzi. During that time, the sun produces those lights which contain a lot of vitamin D. Now, what does vitamin D do? It improves ovarian stimulation. Like vitamin D stimulates, increases the stimulation of the ovary. And when the ovary is stimulated, it means that it is going to be able to produce or to mature many eggs, and therefore ovulation will take place. Now, there is a research which was done, and it linked lack of sun exposure or lack of vitamin D to infertility. Actually, this is a research which was done in 2019, a 2019 analysis. And it found out actually that, this research specifically found out that women who were infertile and having polycystic ovarian syndrome had low levels of vitamin D in their body. And actually, it was also found that these women were not so much being exposed to direct sunshine. These are women who were found, they are always in ACs, they are always in their rooms, they are not exposed to sunshine, and these are women who were prone or who were found to be having polycystic ovarian syndrome, and these are women who were infertile. So, because of that research, we can now reliably say that vitamin D can boost the fertility of your body. Now, which dose should you take? You should take around 2,000 to 400 international units daily. So you go to the pharmacy, go to the hospital, ask for vitamin D, 2,000 to 400 international units. Of course, it will depend on your body weight, but that's the range. Take it daily. Probably you'll boost your fertility. Another vitamin is vitamin E. Most people know vitamin E for skin issues, improving the skin quality and so on, skin diseases and so on. However, vitamin E, you shouldn't forget that it is also an antioxidant. It is an antioxidant. And because it is an antioxidant, it boosts the general reproductive health of a woman. Therefore, you can still try it, not so much specific to boosting the fertility, but you can try it, especially because you know women who have tried to get a child for years, they know how hard this is. They know the struggles they pass through, and therefore they would use anything in order to boost their fertility. Therefore, don't leave this vitamin E. You can take it. You can take 15 milligrams on a daily basis, and you can be able to boost your fertility. There is another vitamin. I don't know if you guys call it a vitamin, but it's folic acid, the usual folic acid. Now, folic acid has been naturally known for antenatal care. Like after conceiving, you take folic acid, and it helps in preventing the neural tube defects. What I mean by neural tube defects, I mean like a woman who is a child who is born when there is a hole at the vertebra. You've seen in your areas, a child is born and there is a hole at the vertebra, at the spinal cord, there is a hole and some things are passing through. And those, of course, those children cannot live without surgery. They have to operate them, and in most cases, they receive a lot of difficulties mental retardation, even physical strength and so on. They really receive a lot of, and that's why we encourage women to take, the other time I was talking about, in the previous video, I was talking about antenatal care, and we talked about taking folic acid daily the moment you conceive. Now, folic acid is also going to be very important even before conceiving. Even before conceiving, research has shown that when you start taking folic acid early, you improve the chances of conceiving. Now, there is another stuff which is very important, that is iron. There are a lot of theories, all conspiracies. People ask, is iron a vitamin or not a vitamin? But I'll classify it here as a vitamin for the interest of our discussion. Now, iron is important in maintaining your blood. Because when you lack iron in the body, of course, you'll get anemia. When you go to the hospital and they say you do not have enough blood, it means most of the anemias are contributed by iron deficiency. So having iron, boosting your iron in the body will improve your general health, and also will increase or boost the chances of getting pregnant. Now, there is a study which was done in 2006. It was done on 18,000 women. This research showed that supplementing a woman with iron will decrease actually the risk of ovulatory infertility. 18,000 women, research was done, and it found that when you supplement these ladies with iron, you decrease their risk of getting ovulatory infertility. It may have little evidence, but we have tried it in some women, and these women have boosted their fertility. Therefore, you can try it. Try it. Iron, take 27 milligrams daily. You'll see that the results may be good. Now, there is this very important stuff called omega-3. Omega-3, several people have talked about omega-3, especially people in alternative medicine. They really talk so much about omega-3. But what does omega-3 do? Omega-3 improves the general reproductive health. Actually, it doesn't have a specific area it attaches itself when we're talking about fertility, but it just does the general body health improvement, and especially on the reproductive health, system. And therefore, that's why we also encourage people to take omega-3 when they are striving to get pregnant. Now, where can you get omega-3? You can get it from seafoods. The seafoods, the fish in the sea and so on, the seafoods, what we call the seafoods. You can also use pills, the fish oil pills. They are fish oil pills. And the dose should, there are also tablets which contain omega-3, even the fish oil pills I've talked about. So the dosage should be 500 to 1,000 milligrams on a daily basis. There is another very important vitamin called selenium. Selenium is so much known, actually, when I will be talking about zinc. Selenium and zinc are so much known for male infertility. But I'll be talking about male infertility in one of my next videos, about the vitamins we use in male infertility, especially in low sperm count, poor motility, and so on. But selenium helps to maintain the health. It helps to maintain the health of follicular fluids surrounding the egg. You know, the egg or the ova has fluids. We call them the follicular fluids that are surrounding the egg, that are surrounding the ovum. Now, what maintains their health is the selenium, a mineral called selenium. Now, because selenium maintains the health or promotes the health of the fluid, the follicular fluid surrounding the egg, it will promote the health of the uterine follicle. It is derived, it is far-fetched. No. We know that selenium facilitates the good health. It promotes the good health, or it shields the egg. And then the egg remains healthy and well. Selenium. And because of that, it means that the uterine follicle or the egg is going to be protected. It is going to be kept healthy, and therefore it will boost its maturation and thus ovulation. Therefore, selenium is very important in reproduction or in fertility. And the dose you can take 55 micrograms every day. And there are some foods that contain selenium, like the Brazil nuts, the turkey and tuna. Actually, I don't know if you guys have ever tasted the turkey meat. It's also very, very sweet, but that turkey meat contains a lot of selenium. You can try it. Now, another vitamin I'll talk about here is zinc. Like I've talked about, like I was discussing the selenium, zinc is also in the same shell with selenium. But zinc, to be particular, zinc helps to facilitate egg development. Actually, it facilitates egg development and it facilitates fertilization. A very important vitamin. It facilitates egg development and facilitates fertilization. There is a research which was done by Robinson Institute, Adelaide Medical School, and it found that low levels of zinc were associated with longer time of conception. A research which was done by those two, the institute, Robinson Institute and Adelaide Medical School, it found out that when you have low levels of zinc, this research, I think they did it on around 20,000 women, and out of those 20,000 women, those that had low levels of zinc took long to conceive. In other words, they had infertility issues, those with low levels of zinc. Therefore, that's why we encourage you to take zinc if you'd like to really boost your fertility. And the last tip I'll talk about is calcium. Calcium, of course, may not be so much talked about, but calcium, we know what calcium does. It promotes the general health of our body. Sometimes you may fail to conceive just because your body is not healthy enough. Your body is lacking calcium. Therefore, you can also take calcium supplements in order to boost your fertility. In conclusion, I have said that these vitamins we've talked about are not the ones that will treat your infertility. These are just boosting your fertility, especially when you are treating the cause. You cannot start using vitamins when you have blocked tubes. You cannot start using vitamins when you know that you have fibroids filled up in your uterus. You cannot start using vitamins when you know that you have a chronic PID not treated that is causing your infertility, and you now want to take vitamins to improve fertility. In case you have a private chat, you have a private question, go to my website www.druthman.com, book an appointment, we shall discuss from there. And if your question is general, it's not so private, you can put it on all our social media platforms. I'll be there to answer you, and the name is Ask Dr. Uthuman. Sign out.
Ask Dr. Uthuman on Sawa Wall.